for sure.
You tell me when you're free, cause your schedule seems to be more packed than mine. So when you're free, just
Good evening. I can. You're breaking up. You're stuck. You're moving again. But yeah, you were breaking up. There was a glitch in between, but I got it. As in, you froze a little bit in between. I can. I can keep mine off as well. Oh, really? So I'm presenting. I'm only the host, so therefore I can keep mine off. Oh. Well, fine. What is it called? What is it called on YouTube? Because I don't have time to send out that link right now, honestly. So I need to tell them what to search for. Really? But do you know that there's a class that does not even that doesn't have a class chat. So when you send the link, so then I hope that everybody checks and sent the link to the parents then. Unfortunately, not. So what's wrong with everybody in the world being able to log on? Is that a bad thing? What can happen? That's what I'm trying to understand. Like what? Okay. I say whatever they want to see, and however form they want to see. Okay. I understand. Right, because it's life. Let me look back and see what this meeting is about. I'm not preparing for it. That's why I'm here early.
Good afternoon.
Good evening.
Good evening.
Good evening, everyone.
Good evening.
Good evening to everyone.
Good evening.
Good evening.
Good evening.
Yes, please. Alicia, do you have any? All right, let me ask.
I'm not aware, Roseanne.
All right, let me ask. The president is going to join. Kenny's going to join right now.
Good evening.
Good evening.
Good evening, everyone.
Good evening.
Good evening, everyone. Mr. Batiste, the doctor, she just sent that to you just in case, but she sent it to me as well. Yeah, no problem.
Good evening, everyone.
Good evening.
Very
Good
good.
evening.
Good evening.
Good evening.
Kenny, I will not be here for the entire meeting. They have another PTA meeting to start at 6:15.
Okay, noted.
Thanks.
Hi,
Letitia.
Letitia. Understood.
No problem.
Good
Hi, good
So,
evening,
evening.
everyone.
good evening, ma'am.
Good
Okay.
evening.
Good evening.
All right. It's 5:05. The principal is here. I see most of the members here. So, Chini, you can go ahead and start. The others would be join us via YouTube.
Okay. And the presenter will join us during?
Yeah, she will join us during.
Okay. Good evening, everyone, and welcome to our first PTA meeting for the school year 2021-2022. I want to welcome our principal, Miss Sharon Jones, to our first PTA meeting with the parents. And I am just so happy that we are able to utilize the technology that is out there as the parents join us through the YouTube link. This evening, we join the world as we campaign towards the awareness of the impact that breast cancer has upon us. So we all know someone, or we know someone, or we know of someone who has been impacted by breast cancer. And this evening, we want to not only talk about the business of our children, but we want to make sure that you, the parents, the mothers, the aunties, are well. Knowledge is power, and that is what we're here for this evening. We want to make sure that you are good so that we know that you're good for the children. We're going to start this evening with a word of prayer by Grace Benskin.
Good evening, everyone. Let's bow our heads. Almighty God, we bring before you this evening our Sharon family. We ask for your guidance and wisdom for our principal, Ms. Jones, and the administrative staff in their decision making on the school's behalf. We grant that you will give our teachers patience in dealing with our children. We ask for obedience and understanding for our children in their daily routines. We bring the parents, guardians, and ancillary staff before you. We ask that they will be supportive and rally around our school. We now ask for your blessings, protection, and safety on everyone in our school environment. This we ask in your name. Amen.
Amen.
Amen. We will now have our minutes from previous meeting. The previous meeting.
He mentioned that a parent tech support group was formulated to assist parents with any technological challenges. This group is spearheaded by the IT coordinator, Mr. Batiste, along with other parents. He also thanked Mr. Batiste and the parents of Jason Burgess, Tavian Ford, Shanika Bryant, Rosario Connell, Aiden Ford, and Shanez Dyer, who joined the tech support group for their assistance. Mr. Batiste also publicly thanked those parents on the tech support team for their continued assistance. He mentioned that the tablets were donated and distributed to students throughout the school from reception to class 4. Mental health discussion. The president introduced the guest speakers from the psychiatric hospital to share some key insights as to how parents can cope in this new environment and how we can encourage our children during this time of online school and COVID. The guest speakers were Senior Nursing Officer of Community Services, Mr. Rodney Topping, and Community Mental Health Nurses, Mr. Carl Green and Miss Kim Nurse. Mr. Carl Green asked some key questions to parents. 1, How have they adapted to this new COVID environment? 2. How they are coping with working from home and assisting children with online school. 3. What activities have they done as a family amidst COVID? Parents shared responses and concerns, followed by a discussion. Suggestions were made by Ms. Nurse on how to cope with anxiety and depression during this time, such as calling a friend or family member, gardening, going to the beach, exercising, and many others. Some parents share their concerns and receive informative information on how to deal with these issues. At the end of the mental health discussion, Ms. Kim Nurse stated some signs to look for in our children as it related to mental health. These signs are restlessness, easily frustrated, easily depressed, not interested, not sleeping or bedwetting, agitation, and getting angry easily. The nurses suggested activities such as going for walks, playing games as a family, movie nights can assist children with coping during this time. Parents asked questions and responses were given by the guest speakers. Mr. Green gave additional contact information and informed parents that they can reach out to them for any assistance. The vote of thanks was given by Ms. Letitia Eversley, and the meeting was adjourned at 6:20 p.m.
Thank you, Mrs. Oliver. I want to take this opportunity once again.
Sheena, before you go ahead, I want to ask that minutes be adopted.
Sorry about that. Adopt the
That's
minutes.
okay.
Okay. Now asking that the minutes be adopted at this time.
Seconded by M. Cummings.
Okay, thank you very much. Okay, so I want to take this opportunity now to welcome once again Miss Charmaine Jones to our PTA meeting. For some of you, this might be your first time getting to meet her because unfortunately, we haven't had a PTA meeting for the term as yet. This is our first one, but we're hoping to have many more and hoping that parents are going to be active. For example, if our drive on Saturday, you will hear more about that later. But welcome, Ms. Charmaine Jones.
Thank you, Miss Wave. Good evening, everyone. My name is, just a minute, I live beside the road, so you will hear lots of noise. Good evening, everyone, again. My name is Charmaine Jones, and I'm the new incoming principal. When I first heard that I was assigned to Sharon Primary School, I envisioned having a very enlightening conversation with parents. Then I was told that we will be online. So I decided to write a letter to you parents. I did, but I never shared it with anyone. This evening, I want to share my sincere thoughts with you through this letter. And it is dated August 20th, 2021, over 2 months ago. It says, Dear parents/guardians, it is indeed a pleasure to be joining your school and your community as the acting principal of Sharon Primary School. I have been in the teaching profession for over 30 years and come to this institution with a wealth of knowledge and experience. Nothing gives me more joy than seeing a child grow, develop, and succeed in his or her academic journey on becoming a well-rounded and successful individual. I believe that as parent or guardian, you can make a wonderful influence on your child by being a role model for your child. Together, we can operate as one functioning body. Parents, teachers, and principal to help our children and our students reach their full potential. In order for a successful partnership to develop, we must all work together as one for the betterment of our school. In this regard, please encourage your child in his or her learning and always pay special attention to your child's progress in class. Please feel free to contact me at any time if there are any concerns regarding your child. Sincerely, Charmaine Jones. I want to say thank you for listening. Over to you, Miss Tate, again.
Thank you, ma'am. I now have the pleasure of inviting our president, Mr. Kenny Olivier, sorry about that, to speak to us.
Hi, good evening to everyone. Um, Thank you, Sheena, for introducing me, and thank you, Miss Jones, for that letter. I is well received and is very timely, given what I wanted to share with everyone today. I'm just trying to set up. I have a visual presentation. I said I would do a little visual stuff here. We're just trying to make it set it up properly. Just give me my boring voice. So I share now. Right. So I believe everyone should be able to see it now. Right. So I just want to just go over some things here. We have some new parents in our midst, and we would have had a discussion about the PTA thing a while back, over a year ago when we first came in. So just as a refresher from some of the other parents as well. I said that the principal's letter was sent because she mentioned one functioning body. And that is what we are as the PTA, the Parent Teacher Association. So our mission statement is to work hand in hand with primary school in their planned calendar events and promote the growth of the Parent Teacher Association. Our aims and objectives is to promote closer relationships between home, school, the church, and community. To provide a forum for frequent discussions between parents, guardians, and teachers, as we're doing now. To educate parents with respect to the importance of guidance, discipline, affection, a good example in the upbringing of children. To assist in the organization and promotion of extracurricular activities for the school, and to assist the school in areas deemed necessary by the association, and to raise funds for the proper execution of the aims and objectives of the school. All right. Some of these were more challenging than others, given the year that we have had and continue to have. What I want to just continuing the membership talk about is the membership. The membership of the association shall consist of the following: any parent or guardian of a child attending Sharon Primary School, parents and scholars will be required to pay a PTA subscription at the beginning of the year, and any member of staff of Sharon Primary School is also included in this category. And I just wanted to draw this point here. Again, as I said, the principal talked about one functioning body. A lot of times people will think that the PTA just consists of the executive team members. and when they say that, I think that those persons are responsible for A, B, and C as relates to anything at school. But it's for all parents and all teachers to assist. You see here that once you have a child attending school, you are part of the PTA, right? They are executive members, yes, and they play a key role. These are just regular persons like everyone else with responsibilities. They go to work, they take care of the kids and family. They have other responsibilities and challenges to deal with like everyone else. But they have taken the added responsibility of seeing all the children at Sharon Primary as their own, as their wards. Mrs. Stable always says she has hundreds of kids. And this is how we, the executive, have chosen to see the students at Sharon Primary as all of our own. So I take this moment to thank my executive team for the sacrifices they've made during the year to, just try to be there and go over and above for the school. And I want to thank also those parents may not be part of the executive, but there are many that help along the way, and teachers as well, to help along the school, help another parent or help another child in any way. I want to thank you. In looking back at what we would have done over the year, yes, it was a challenging year, but we would have, been able to do some things. We came in October. Sorry, that should be 22nd of 2020. So it's actually a year that we have been here. The constitution, we changed up. We had executive meetings because we meet from time to time to, to look at situations that are a challenge to the parents, a challenge to the children, a challenge to the school. And that's where you can see we would have come up with the IT support group, be able to get some tablets donated because we're working behind the scenes. We helped with the asphalt cleanup in May. Had two activities to plan cleanups there. We assisted with the library painting, as you see over there with the pretty colors. Unfortunately, wasn't be able to get the books in because of logistical challenges. And we had our meetings along the way. We started with the independence quiz. We had meeting as relating to the return to online classes. And as Mrs. Oliver spoke, we had a session on mental health. Right, and then we had the cleanup, as you can see picture there. We did a presentation to the outgoing principal, Mrs. Small Williams, for her tenure of the school. And you can see we did a donation to the top students, top girl and boy of last common entrance. So I would say we still were able to be active in this time. It was a challenge, even getting a lot of these things done, getting people mobilized, trying to do things following the protocols, and knowing that persons had other responsibilities to deal with, especially during this time. But I'm so grateful that we were able to still achieve some things, quite a few things over this last year. And going into this new year, there are activities that we are looking at right now that we will engage you on today and going forward. Right. So in saying that, we have some vacancies right now. We have a vacancy for a secretary. I can tell you the role secretary to keep a true and accurate record of all proceedings and minutes of meetings of the association management committee and countersign the same. Count all votes except those cast by ballot. Present minutes of previous meeting. Prepare in advance all agendas in consultation with the president and send out all notices of meetings when necessary. Be responsible for all correspondence of the association. Delegate to the assistant secretary his or her duties and serve ex officio on all subcommittees. There's also a vacancy for parent rep. And his responsibilities or her responsibilities to liaise between the parent-teacher association and the parents in each department. we have parent reps that go from school year to school year, motivate parents to become actively involved in the activities of the association and attend management committees on a regular basis. We also have the tech support group. It's not necessarily a vacancy, but we just want to, given this is something that is very present at the moment in terms of online class, we just want to add to these numbers. Um, the tech support group, I think, is a very good initiative. It's basically parents with IT background who will lend assistance to parents who are having trouble with devices or the Google Classroom platform. So what will happen is that the parent will log the issue with their class teacher, who sends the request to Mr. Batiste, the IT coordinator. He then, with the team, then he would select a member to assist, who would probably put a ticket so that they could monitor that situation and um, tag it once it is finished as complete. All right, so I think that is a very good initiative. We had some parents, and again, I thank those parents who were involved in so far in this situation. But we want to continue it as we have parents leave and new parents come in. We want to have them join where those would have left off. As it relates to this, Mr. Batiste, I don't know if there's anything that I would have missed here. All right, thank you. All right. Even in this situation, I could tell you because many of the parents live pretty close. Um, some are able to go out to eat to one another to look at the actual situation, maintaining all COVID-19 protocols as you would imagine. All right. So if we have any parents with the IT background, we will be seeking your assistance. Maybe you can join this group that we have. A letter will be drafted and sent to the class chats with details on how to apply for all these positions. All right. All right. So yes, we need persons to support as the IT group. We need a secretary. We need people to support, and many hands make light work. But we know money is something that's always necessary in accomplishing any needs of the school, the need of the parents and of the children. There are various needs that we would like to have ourselves involved in, and we at least need some support, some funds to help springboard us to be able to do that. Last year, we didn't collect any fees. We had a moratorium on collecting any fees, just like how many business places would have done. That would have been too in-depth for us to answer that question in that time. Um, we didn't have any fundraising as well. So the PTA wasn't really able to accrue any sort of funds. And what we did was basically try to use um, what I would say a particular set of skills to get um, assistance as best we can. This year, we want to start back the collection of fees. And what we're asking is for $10 per household. I think the previous year was $20, but we're asking, want to be understanding of the situation and ask for $10 per household. That means basically then that if you have two children at Sharon, it would just be $10. If you have one, it'd be $10. If you have four, it'd be $10. Mind you, if you are able to assist with more than $10, we would be grateful because we understand that every person's bread is not buttered the same way, and that is not only in a negative sense, but in a positive sense as well. So if you are able to assist with more, we will be very grateful. Payment options will be a sealed envelope with the $10, the name of the parent, and the children that they have attending Sharon with the parent's email address. You draw it into the post box at the entrance of the school, or a drop box that will be placed in the office, which should be accessible once the principal is at the school. So once the post box and the drop box are cleared, a receipt will be sent to the parents' email that we have received the funds. All right. Again, a letter will be drafted and sent to the chats in relation to this as well. So, as I said, if you if you can afford to give more than 10, we'll be very grateful, because what we do is basically put it back towards the school, put it back towards those children in need, put it back to support any initiative that we can see to help children, help the students grow to their best capacity, help the school be able to help the children grow to their best capacity. All right. Right. So that said, I, I wanted to share something with you. I was looking at our school, and there's about 400 children enrolled, right? Which means, well, 400 plus parents. Or I say 400 parents because they're more your brothers and sisters at the school. So what we wanted to do was be innovative going forward in ways we can assist the needs of the school, whereby we look at, different places do different things, and we're thinking about how we can support from within, you know. So what we have is something called the Sharon Network. Um, is basically seeking to encourage a strong culture of parent participation. I think there's a national drive now to have more parents involved in the the the, the conversations that relates to school and parents, because we all know when parents, invest more time in what's going on in the child's life, that's a proper investment, and that child will do, 5, 10 times as much as one that's not invested. So this is an important thing that we need to do for our children. All right. So we want to help connect parents' skills with opportunities to participate. We are asking all parents to complete this quick survey. We use information to create a database of parent skills, and we call it the Sharon Network. All right. This network will be another tool that helps us foster a strong partnership between parents, teachers, families, and the school. We managed by the PTA exec and the school, and we use it to identify parents who can assist with certain activities or projects at the school. So this is how it works. It will come to you by link or by email. You put in and you put in your email address. You put in your name, right? You put in the name of your children. You put in the name and the class of the first child, the second child, the third child. Well, if you have 4 children, well, congrats to you. I guess you can make a note next to the child number 3. But no, but three would just be necessary. Your phone number, and then we have a doing or what they may have, of they do at home, but and they try to, label themselves or put themselves in the box of what they can only do this thing. But I just want you really to think about what you can do, what you're good at, and what you're able to assist, because you have quite a wide range here. Some people are good at accounting, some are good at art, carpentry, computers, and IT. Where we use the computers and IT to build the support group, we want to actually even go forward with looking at a web page for the school, and people with that kind of background can help us there. Engineering, just detailing the next section. Nurses, firemen, policemen, we may need people to come in to speak or help in a particular situation. First aid, food and beverage supply. Whereby we don't actually need funds, we can have people that are able to help us to put us on people that will be able to help us get that, or help us get at a better cost. Who knows? Food preparation. Then we get back out there, maybe, we want to have fundraisers and fairs and selfish cakes and all that kind of stuff. Foreign languages, why we can't have our children, learning these languages at a young age. I think we had I think last year we had, or year before, we had a activity where that was involved. Gardening, graphic design, health, historians, knowledge of other cultures, landscaping. Yes, the school needs to be upkept. Legal expertise, we may need something there. Um, Marketing, advertising, masonry, maths, music, lessons, that need a performance in it, entertainment, that kind of stuff. We may have an event and we may need someone to perform or showcase and draw people. Photography, we're doing something, we need someone to take pictures for us professionally because there's sports experience. Um, I remember Miss Mr. Map came over from that's the one I helped the boys do well during the football competition. You know, politics. You know who that is? Professional speaking, religious leaders, science, security, suing, shuttle service, me to get from here to there, social media experience. This is the way the world is going. Volunteer work, very important. We always need numbers. We always need people to lend a hand. Web design, I mentioned that before, and any other you can detail in section below, right? So, right, and then you just any you detail there, and then it's basically complete. So this is how it looks on the laptop. But just to show you quickly, if you had to look at it um, on your phone, this is how it will look like. Basically, do that. Comes by email, tells you the same thing I just told you. You just write in quickly. You tick as you go down, and you submit, and basically that is it. So I just want to share that with you um, because I think where we are right now and where the country is trending and I know the world is trending. The traditional ways of us working, of us trying to just say, well, is their responsibility, is the PTA responsibility, or us going somewhere and saying that we're from the PTA and we want you to help us with this. That's not going to work because everyone has less resources and are less willing to give unless they get some proper return on investment. And with more numbers, with more of us working together, I think we can bridge many gaps as relates to any issue that we have within the school. So the thing is great. I just want to encourage you all, to lend assistance wherever you can, where you are doing it. Please continue to do so. Be encouraged to do so. And we I look forward to seeing many of you request to join up with the executive, and I look forward to seeing many of you join us in our other activities. All right, so that is it from me. Um, so that's it for me, Sheena.
Okay, thank you, Kenny. Without further ado, we have our guest speaker with us now, Dr. Fazila Hafeji. She completed her MBBS degree in 2008 and graduated with honors from Kayfield campus. She subsequently completed her DM in general surgery in June 2018. She is currently in private practice and is also a consultant at the breast screening program of the Barbados Cancer Society. She's also full of knowledge and she is here to empower us. Welcome, Miss Hafeji.
Okay, good evening, and thank you as well for the opportunity to present and share some knowledge with you guys. I'll try to share my screen, but I think you might have to do that for me. Uh, yes, I think you better go ahead and share the presentation because I tried earlier and I'm not sure if my computer is not permitting Google Meet to share the presentation.
All right, I'm looking for this. Let me just pull it up. Dr. Khadija, you sent it to the PTA email.
Yes, I did. I can resend it.
Uh, yes, because I'm not seeing it.
Well, the email.
Or Mr. Pettis, if you received it, just send it to me. I don't know.
I just resent it because I realized that I had sent it to the email that I had received the link on.
Oh, okay. Well, that's all right. That's all right.
So, if I may ask, most of the parents here are women, correct?
Well, I can only speak for myself and say I'm not.
So, I see, I know you, and there's a Fabian, but I think all the other names that I'm seeing are female names. Oh, okay, I see. Okay, okay. Pardon me? Oh, okay. Okay, okay. Well, I mean, obviously, breast cancer is a more is a condition that mm, affects women much more. But of course, men will have women in their lives that will be affected or maybe affected as well. So I think it's still obviously relevant and important. But definitely, I suspect that more women will be interested in this topic.
Yes, I have it.
Okay. All right. Thank you. So there's some slides that I might go very quickly through because I understand it's already a bit late, but most of it will be the signs and symptoms and a little bit about screening on breast cancer. So can you do the next slide for me, please? So this is a basic structure of the breast. It's actually a modified sweat gland, and the breast consists of lobes, about 12 to 20, and these lobes are further made up of the lobules, as you can see in the picture. So the lobules are where milk is made, and then that goes along the ducts into the nipples. The space between the lobes are filled mostly with fat, as especially as a woman gets older. Younger women tend to have more connective and supportive tissue, such as ligaments. There are also blood vessels that bring blood to the breast and take blood back to the heart, and then the lymphatic vessels. And as I said, the ducts drain to the nipple. So most breast cancers, about 80% of them actually occur in cells along the ducts. About 10% occur in the lobules. And the other 10% are different kind of cancers, such as sarcomas. Rarely you will get a lymphoma, what we call a cancer from a lymph cell occurring in the breast. Next slide, please. So the lymphatics of the breast actually drain to lymph nodes in the armpit, and that's what most people will call waxen kernels. So those waxen kernels will also drain lymphatic fluid from the upper limb and but also the breast as well. Okay, next slide, please. There's some basic definitions. A tumor is a swelling of any part of the body, usually due to an abnormal growth. And this tumor may be benign, which is not cancer, or it can be cancerous. A neoplasia is more of a medical terminology for the same tumor. So it's a new abnormal growth tissue. Next slide. So cancer is where there is uncontrolled division of an abnormal cell. So normally if you have a cell that is old or aging in the body will undergo, that cell will undergo something called apoptosis, which is controlled cell death. With a cancer cell, that regulation is no longer there, and the cell divides uncontrollably and rapidly. And when that develops in the breast, you get breast cancer. So if you have cancer in the breast, and it has not spread, it will not kill you. It's when the cancer spreads outside to the vital organs and it affects the functioning of those vital organs. That's when cancer will affect the quality of life as well as result in mortality or death. And for breast cancer, those metastases, or what we call deposits or secondaries, are usually most commonly in the lungs, in the bones, in the liver, and in brain, and also brain metastases. Next slide, please. So the stage of a cancer refers to the extent of its spread. So if a breast cancer, if it's limited to the breast alone, it is stage 1, and that's usually the earliest stage that has the best prognosis. Patients with stage 1 disease can live what we call a 5-year survival is 98%, versus with stage 4 where metastases have occurred, and these metastases are again to the bone, the liver, the lungs, and the brain. The 5-year survival there is a lot less, 22%. Stage 2 and 3, it depends on the extent in the breast as well as the extent of the lymph nodes. And these are usually lymph nodes in the armpit, but then also some lymph nodes along some vessels inside the chest. So asymptomatic means that you have no symptoms of a disease, and there's where screening comes in. So with screening, you're trying to identify a disease before symptoms or signs arise. So if you have a woman who decides to get screening for breast cancer, many times asked by a mammogram, she has no pain, no masses, no lumps, excuse me, no change in the skin or the nipple, and she's going to get a mammogram to detect an abnormality before symptoms or signs arise. And the good thing about screening is that most cancers that are detected by screening are a very early stage, where surgery alone, excuse me, in many cases is curative, and other modalities of treatment are less likely to be needed. Next slide, please. So some breast cancer statistics from the breast screening program for the year so far. So we've performed 3,000 mammograms and 500 ultrasounds. And this has resulted in 120 breast biopsies. And I will mention how the biopsies are done and a bit later. And they've confirmed 50 breast cancer cases. Of course, this is just one part of Barbados. So other cancer diagnoses will be made in doctors' offices, particularly surgeons, as well as at the Queen Elizabeth Hospital. Patients referred from both private and the polyclinic to the hospital. Patients will be diagnosed there as well. So this is not the figure for the number of women diagnosed with breast cancer in Barbados for the year. But on average, is between 120 to 140 new cases a year. We've had 4 positive cases for patients under the age of 40. And next slide. So looking at the risk factors for breast cancer, they're divided mostly into non-modifiable, the ones that you can't change, that you can't do anything about, and then modifiable, usually related to lifestyle. So female gender is obviously one of the biggest risks. So I don't have the actual stats for Barbados, but in the US, the risk of a woman developing cancer in her lifetime is about 12%. And 1 in 8 women, and this is mostly US, but this would be applicable for most women, are at risk for developing breast cancer. Less than 1% of breast cancer patients are men. and the risk of a man developing breast cancer is about 1 in 833. So if you take 833 men, one may develop breast cancer versus 8 women, one will develop breast cancer her lifetime. So advancing age is one of the biggest risk factors as well. As a woman gets older, her risk for developing breast cancer increases. So the figures I have here is the risk of a woman at 20 years old developing breast cancer in the next 10 years. So if you take 1,732 women at who are in their 20s, one will develop breast cancer in the next 10 years. And that figure decreases significantly, so that when you look at a 70-year-old woman, the risk of her developing cancer in the next 10 years is 1 in 26 70-year-old women developing breast cancer. So it really is a condition that's much more commonly seen as a woman ages. Most of our breast cancer diagnoses occur in women between the ages of 50 and 60 years old. This is in Barbados. Next slide, please. So some other non-modifiable risk factors are people who have a genetic predisposition, so certain mutations, the top two being BRCA1 and BRCA2. If you know about the Hollywood actress Angelina Jolie, she actually is a BRCA1 carrier, and she decided to have both breasts removed prophylactically to reduce her risk of developing breast cancer. And because it's also associated with ovarian cancer, she had her ovaries removed as well. So if you have a family history of breast cancer, your risk is higher than an average. If you've had a personal history of breast cancer, Caucasian women and African American women or Black women have a higher risk of breast cancer than Asian and Indian women. If you have a personal history of certain proliferative breast diseases, that being atypical ductal and lobular hyperplasia. An early period and late menopause means that you've had more estrogen exposure. The breast has had more exposure to estrogen, and as such, a higher risk of developing breast cancer. Also, if you have chest wall radiation, especially as a child, for some certain conditions, a child may have been exposed to chest wall radiation, and that increases their risk for breast cancer. Next slide. So then they're lifestyle related and modifiable, such as alcohol use. If a woman drinks 2 glasses of alcohol, whatever kind, a day compared to a woman who doesn't, her risk is increased. Obesity and physical inactivity. If you've never had any pregnancies, then you're also at higher risk than a woman who's had children. If you've never breastfed, if you have used birth control pills, especially for about 5 years or more, and sometimes in women who use hormone replacement therapy to help with their postmenopausal symptoms, that also, and that's usually over a period of 6 months, that increases your risk of breast cancer. So breast implants is associated with a very rare type of lymphoma, rather than a breast cancer, but it is a risk factor. Next slide, please. And those are just some other genetic abnormalities. Next slide. So some of the signs and symptoms of breast cancer: a breast lump. Of course, most lumps, the majority of lumps are not cancerous, but a lump is a very common presentation of breast cancer. Similarly, a lump under the arm, which may be a waxen kernel or lymph node. Skin ulceration, where there's a break in the skin. A bloody nipple discharge, as opposed to a nipple discharge that is milky or yellow or green. Rarely would breast pain present as breast cancer. Sometimes it can actually mimic an infection where there is redness and swelling, and the person may get antibiotics and there's no improvement, and it may be associated with a inflammatory type breast cancer. Patients may present with a rash, nipple inversion. So if you've always had, your nipples are everted, and then in your 40s you notice that one nipple has now become inverted, that's maybe a symptom or maybe a sign of breast cancer. It's orange peel or pitting appearance of the skin, which I have a picture later. And then dimpling of the skin or an increase in the breast size compared to previous. Next slide. So this is an example of the nipple inversion and the peau d'orange, which the swelling of the breast and the obstruction of the lymphatics results in swelling of the skin and dimpling that mimics how an orange peel would look. Next slide. And this is ulceration of the breast where the skin is obviously eroded and there's areas of ulceration and pink tissue. Next slide. So later symptoms are associated with metastases or spread. So headache, seizures, visual problems, especially like double vision, can be signs that the cancer has spread to the brain. Loss of appetite and weight loss as seen in any metastatic cancer. Shortness of breath or cough from lung metastases, jaundice from the liver being affected, and then bone pain or pathological fractures where the bone is weak and you easily get fractures compared to a healthy bone that's not been affected by cancer. Next slide. So screening for breast cancer is not going to prevent it, but it allows for a detection at a much earlier stage, and therefore you're more likely to be able to cure the patient as opposed to if they present late, waiting for symptoms to develop. By then, it may have spread to the lymph nodes or to other organs, and then the treatment generally involves a lot more as well. So there are varying institutions and guidelines. Most recommend starting average risk screening at 40 years, and then there's some that would recommend screening at 50. I think that it is the most common cancer in Barbadian women after skin cancers. Is also the cancer that takes most Barbadian women's lives. So I would recommend screening at 40. And if they're average risk, you can get a mammogram every 2 years. And then from 50 to 60, you can get a mammogram annually. Of course, if you have a family history, then you may need additional screening before, and it will be best to have your doctor assess your actual individual risk and make the best screening plan for you. Next slide. So again, the Jamaican Cancer Society also recommends starting at 40. Next slide. So there was a study by Professor Hennis in 2011 that looked at some of the barriers in Barbadian women for breast screening. We don't have a national breast cancer screening program like some places in the US and the UK. When patients reach a certain age, you will get a letter in the mail saying you've reached the age to start screening. No, for us, it's completely up to the woman to seek that screening, unless, of course, her general practitioner discusses it with her and recommends that. But I would say that I think in the last 5 years, a lot more women are aware because a lot more women will come and say, I want to get screened, or I'm feeling something, I'm concerned. So more women seem to be taking and being concerned about breast cancer, especially in October. There's a lot of talks in the media and reminders about it being breast cancer awareness. So perhaps in these last 10 years, things have changed. The fear of mammography is a pain, the way the mammogram is done. And then women always have a fear, well, could this radiation actually put me at risk? And the risk is very, very, very low, to be honest. There's no increased risk in women who are getting mammograms and getting breast cancer. And then there is a fear that if you have cancer, you have to lose your breast, and that can obviously affect your relationship. Sometimes the social stigma. People might be able to tell that you've had one breast removed and so on. And then we don't actually have a mammogram machine in the public sector. Previously, the mammogram machine at the Queen Elizabeth Hospital was working, so patients could get a mammogram there. free of cost, but now all the mammograms have to be done privately. And I'm not sure when that machine will be functioning again. So, of course, that means that this is a cost that the patient has to bear themselves. Next slide. So, apart from mammograms, there are other tests that we will use, such as a breast ultrasound and breast MRI. Breast MRI is more useful in younger women because MRIs are very expensive. They they can take long. The actual test itself takes about 45 minutes. Some people even need to get sedation. If you're claustrophobic, it can be a challenge as well. But it is useful in younger women who have dense breasts and less fat. So it is much more sensitive. So if you have a woman who's at high risk, especially from a genetic predisposition, we might recommend an MRI starting at the age of 25. The breast ultrasound really complements the mammograms. The mammograms will more pick up calcification, and the ultrasound will tend to more pick up cysts or dilated ducts. So we tend to use both of them together. Next slide. So as I mentioned, a biopsy is done. So sometimes we would see the abnormality on a mammogram, or we may actually be able to feel a lump. Most times it's a core needle biopsy where it's minimally invasive. You come, you get the procedure, and you go back home. You get a small injection with local anesthetic to deaden the area, make a small cut, and pass this gun, the biopsy gun, take a few samples and send it off to the lab, where the pathologist, the specialist, will look at it under the microscope. And sometimes we would also use an ultrasound to guide us. If it is a cyst or just liquid, we may remove some of the fluid. And we tend to do that a lot with looking at the lymph nodes. Sometimes we want to know if the patient's cancer has spread to the lymph nodes, in which case it will change the surgery that we have to do. An incisional biopsy is rarely done because of the core needle being an option. But in that case, we would just take a piece. An excisional is when we remove the entire lump. A hot wire localization is when we can't feel, but there's an abnormality. The radiologist will pass a wire into the lesion, and then the surgeon will do a minor surgery to remove the wire as well as the breast tissue around it. Next slide. So there are many different cancers, which I mentioned. 80% are ductal carcinoma, and about 10% are lobular carcinomas. Next slide. And the staging, we usually use a TNM classification. So the T represents the size of the tumor in the breast, the N, the number of nodes, and metastases if it has spread outside of the lymph nodes and the breast. Next slide. Next slide. I don't, and again, next slide, sorry. Right, so as I mentioned, the survival, so stage 0 breast cancer refers to carcinoma in situ, whereas not past the basement membrane to get into the blood or the lymphatics and cause spread. So if it's detected early, the survival is practically unchanged as if you've never had breast cancer. And if it's detected or you present late at a later stage, then the 5-year survival is a lot less. Next slide. So how we know if a cancer is spread, not everyone needs to actually have this staging. So it's only when, especially if the lymph nodes are involved, then there's a higher chance that the cancer is spread. And we would usually use a CAT scan of the chest and the abdomen to assess this. And only when indicated, if a patient has symptoms of brain metastases, would be done image of brain. Next slide. So these are some other additional tests. More commonly, we might do an ultrasound just to look at the liver and the chest x-ray in a very early stage cancer. Next slide. So the treatment, and that's why whenever I have to tell a patient that they have breast cancer, of course, it's difficult to tell them that. Most times it is the thing that the patient doesn't want to hear about. Is their biggest fear comes true. But at least, unlike many other not many, but there are other cancers, like for instance, pancreatic cancer. The majority of patients, when they come, there are really no options. Surgery is not very good. Chemotherapy is not very good. But with breast, there are so many options. So there's surgery, and not it doesn't mean that you have to have a mastectomy. Because you can remove the lump. Like if the lump is small compared to the size of the breast, but the patients have to be able to get radiation. And there are some patients that cannot get radiation. So if you're pregnant and you're diagnosed with breast cancer, you can't have radiation. If you have lupus, you can't get radiation. If you've had previous radiation, you won't be able to get radiation again. And then there's reconstructive surgery. So you can have implants, or you can even do tissue reconstruction, where fat and skin from the abdominal wall, the belly, is transported, and a new breast is created from that. And the advantage is that you also get a tummy tuck at that same time. Radiotherapy, meaning radiation, chemotherapy, hormonal therapy. Once your tumor responds to estrogen and progesterone, there's a medication, a tablet that you would usually take for 5 years after your diagnosis. And targeted and immunotherapy are newer treatments that are available, targeting patients who have HER2 receptor positive breast cancer. And then bone modifying drugs to help with bone metastases. Next slide. I think that is the end of my presentation. If you have any questions, I will be happy to answer them for you.
Thank you, Dr. Hafeji. I want to wish everyone a good evening. My name is Alicia Springer, and I know that we all have sat attentively and listened to this well-presented session. We have a few questions that I know a lot of us would be glad to get answered. I will start with the ones that I have here. If there are any persons in the meet that have questions as well, Mr. Batiste is also monitoring the chat. Or what you can do, if you don't want to type your message in the chat, you can also just raise your hand and we will let you ask your question. So the first question we have, Dr. Hafeji, is, are mammograms painful?
Yeah, so I would say they're not painful, but they can be uncomfortable, especially if you have small breasts, because how a mammogram is done is that the breast is, I don't want to say squeeze, but kind of, yeah. So you want to get the breast as flat as possible, squashed, as Miss Jones is saying. That's correct. Is squashed to get the breast as flat as possible, so that you can get the best image between the two plates to pick up that picture. So they're not painful, not for the majority of women, but I've had a few women tell me that it was painful. So if you have small breasts, of course, then it is going to be harder for them to get the breast tissue into the plates. But it's not painful, not for the majority of women, I would say. But uncomfortable, yes, I've had people tell me it's been uncomfortable.
Okay. And is a mastectomy always necessary as part of breast cancer treatment?
No. So especially if a woman presents early, and if you have a small lump in a moderate or large breast, and it generally is in a less aggressive cancer. So women who are premenopausal, who've not gone through menopause, especially let's say a woman who's 45 and under, they tend to have more aggressive breast cancers. And that is generally because there's a stronger genetic predisposition. So unfortunately, those women, you actually most times recommend definitely removing the breast, and then sometimes removing both breasts to prevent cancer from recurring. But majority of cancers don't occur in women under 45. They occur in older women who've gone through menopause. And if the lump is small and the breast is big, we can remove just the lump and the breast. But it means that you have to get radiation, because what the literature has shown us is that remove the lump plus radiation, the overall survival is the same as if a woman had a mastectomy. So you can't have a contraindication to radiation. Like if you have lupus and you have breast cancer, you definitely have to get a mastectomy.
Okay, thank you. The next question is, do I have to get chemotherapy as part of treatment for breast cancer?
So the majority of women do have to get chemotherapy, and that's because breast cancer treatment tends to be very aggressive because most women are candidates for chemotherapy. If you're over 70, actually, because the type of breast cancer that affects women over 70 tend to be less aggressive, they may not require the chemotherapy and the radiation. But younger women, we would generally recommend it um, because of the improvement in the overall survival. So we're looking at the benefit over the risk of the chemotherapy. And the chemotherapy for most women undergoing breast cancer is not is generally very tolerable. I would say most women can continue to work even during the chemotherapy treatments, except for maybe the day they're getting the chemotherapy and the day after.
Okay, I know this other question is on a lot of ladies' minds, and I guess this is one that cause a lot of fear as well, and it is, will I lose my hair if I get chemotherapy?
So I would say about 99% of women do lose their hair when they're going chemotherapy for breast cancer. But the good thing is that once the treatment is completed, the hair will you will get back your hair will grow back. So I see a question in the chat. For women with fibrocystic breast changes, is the likelihood of breast cancer greater or less or no difference? So there is actually no difference with fibrocystic breast changes alone. It's only if you have biopsies showing atypical ductal or hyperplasia or atypical lobular hyperplasia, and that's not really seen with fibrocystic breast changes. So that is not a risk factor for breast cancer. It doesn't increase your risk, I should say. About 50% of women.
The next one is, can I work while undergoing chemotherapy?
Yeah, so I find the majority of women can. So most times there are two different chemotherapy regimens. So you get about 6 cycles of one kind and then 3 to 4 cycles of the next kind. And it really is given over a period of months. So you would get chemotherapy one day, and that day may be really bad, and next day may be really bad. But then after that, most women I found are pretty okay. And then the next cycle will not be for another 3 weeks at least. So yes, the majority of women continue to work while undergoing chemotherapy.
Okay. And is radiation unsafe?
So radiation is generally safe, but there are some risks with radiation. So especially radiation on the left side, because the heart is there. And this, what I should say, is the radiation that we have available in Barbados is what we call wide beam radiation, as opposed to a more targeted radiation that you would get with a linear accelerator. And how that radiation is done is a small dose is given every day, Monday to Friday, for 4 to 6 weeks. And that's because that radiation, it is not just unfortunately targeting the area, but it can also affect other tissues. So on the left side, it can affect the heart. So if you are diabetic and hypertensive, or you have other risk factors for heart disease, radiation can make that heart disease worse. So in such a patient, they may be unsafe. Additionally, there's a very, very small risk of a certain type of cancer occurring in people who've had radiation, but that generally is like 20 years after. And that is a very rare sarcoma. But overall, it's safe, and overall, it has made a big difference in cancer care, especially in allowing a woman to not have to get a mastectomy.
Okay, thank you. And there is another question. Now, in terms of the mammograms, I know that a lot of persons were told that they don't administer this to persons under a certain age. And we as women were advised to do our own breast self examinations. So what about some women that have natural lumpy breasts and are not able to get this exam? How would they be able to know whether any of these lumps could be cancerous, or if there's a lump there that they should worry about?
Right. So the reason that mammograms are not really recommended in younger women, especially women under 40, is that younger women have a lot more dense breasts. They have a lot more connective tissue, and there's less fat. So the mammogram, the X-rays, the radiation might not be able to penetrate, and there may be something there, but the mammogram is not detecting it. So if you're under 40, I would still say it's a good idea to examine your breasts. Maybe once a month. Definitely as you get over 40, for sure, I would say once a month. But what can be done is a clinical breast examination. So that's either by a general practitioner, a breast specialist, a nurse practitioner who is trained in doing the breast examinations to be able to tell you if this is just lumpy breasts. There's a lot of women have just lumpy breasts. And then sometimes that's when we might order an ultrasound of the breasts, because that will be able to better detect um, in the dense breast tissue in younger women than a mammogram. And then in a rare occasion that we think something else is needed, we would want an MRI of the breast.
Okay, thank you. Are there any other questions? Mr. Batiste, can you let me know if there are any questions via the YouTube chat? Okay, and I'm not seeing any other messages in the chat. Are there any more questions before we move on?
So there's ongoing literature, and I know that there was a Barbadian researcher who had found the association with breast cancer in African American and Black women, so women in the Caribbean, and she linked it to a gene that she later called the queso gene. When we look back as well, even in African women and Nigerian women, the incidence of breast cancer is very high. So we don't have the exact genetic mutations at this time, but it is something in the genes that we share with women, even in Africa and Nigeria, Bahamian women, American women, and that is a genetic predisposition, especially to the more aggressive triple negative cancer that tends to present in younger women. Welcome.
Okay, thank you, Mr. Batiste. All right, so since there are no more questions, I just want to thank Dr. Hafeji on the behalf of the parents and staff present here this evening. I know that you have took your time out of your busy schedule, and we thank you so much for being here with us this evening and sharing this much needed information with us. Thank you again for coming, and I hope that you have a safe evening. I'm going to hand over now to Mr. Oliver.
Okay. All right. And thank you again for the opportunity. And I really do hope that you learned something and that you got some answers to any questions that you may have had. Thank you.
Yes, we did, and you're welcome.
Okay. Thank you. Good night.
Okay. Dr. Hafeji has given us some very good information. I know is information some of us would have had already. It's some information some of us would have never heard before. But again, it is good information to always have to be reminded of what the ladies will need to look into and what men will need to understand as women go into these situations. Um, I want to share something with you guys. Coming out of what Dr. Fizia said on this whole entire month that we have here. You know, yes, we have COVID, and yes, we have challenges with online school and that sort of stuff, but we we want to host a gift back or to celebrate those ladies who are challenged with breast cancer. So I just want to share something with you quickly, if you'll allow me to share. Yeah, let's see here. There we go. Let's share as best I can. All right, so we are having a breast cancer donation drive-through. Dr. PhD said that, in Barbados we have 120 to 140 new cases per year, and she said the incidence of cancer, of breast cancer, black women is very high. So we want to do what we can on our side to support. And this beautiful artwork here, which was done by one of our members, Letitia Eversley, um, showcase what we would like to do this weekend. It's Breeze Let's Donate to the Cause, the Sharon Primary School PTA, a breast cancer donation drive-through, Saturday, October 30th, 9 to 12 p.m. at the school. And all proceeds will be donated to the Barbados Cancer Society breast screening program. All right. So I'm hopeful that you guys will be able to come out and lend the support to those who are currently undergoing this challenge. We heard the challenges of what women may face, losing a breast, how that affects them and their loved ones, maybe losing their hair. As I heard one woman say, your crowning glory is your hair. So it has different emotional, not only the physical and the mental, the emotional stuff related to it. So whatever we can do to support the women that are going through this challenge, we will let you do so. So how this works is basically, we have the roundabout at the school. Just basically, we don't have the walk right now, but we could drive. Yeah, so we basically drive up to a tent that will be there. You just place your donation in a receptacle, a drop box that will be there, and then you drive off. We will ask that you follow all protocols. You have your mask, you sanitize the bin, everything. A dropout is made, and sanitize hands as we get there, and so that we remain um, grounded in this entire situation that we have. But we still want to go forward to donate to the Barbados Cancer Society breast screening program. Yeah, so this information will be shared via the class chats. So I just want to encourage you between 9 to 12 tomorrow. Just come out, whatever you can give. We are very grateful. It is also an opportunity. You can bring your PDF fees as well if you want to do that at the same time. Just make sure that the envelopes are separately labeled so we know which is for what. But yeah, come out, bring the picture in the back of the car. Just carry them around the around. But let us see Sharon. They ain't see Sharon in a little while. Let us come and see Sharon and let's do something for those around that are affected by breast cancer. All right, so that is it for me. So over to you, Mrs. Tate.
Okay, thank you, Kenny. At this time, I'm going to open the floor for any other business. Feel free to raise any points. Feel free to type in the chat any concerns you might be having or anything that you want to raise. Mr. Batista, you can let me know if there's anything going on, anything being typed in the chat. Okay. Having no further business, I want to thank everyone for logging in, signing on, and being part of our PTA meeting, our first PTA meeting for the term. I want to thank the committee for the work that they've put in to make this meeting possible. Even though she's not here, I want to thank for Dr. Hafeji. I want to thank the principal, ma'am. Thank you for attending. And once again, I want to remind you, as Mr. Oliver said, the drive-through is on Saturday. Come out, bring the children. It is good. Let them see Sharon. And have a fantastic night, everyone.
Thank you, and the same to you. Bye-bye.
Bye.
Thank you. Bye.
Thank you and
Goodbye.
good night.
Bye.
Goodbye.
Good night to everyone. See you all this weekend.
Thank you. Good night.
Good night.
Good night.